For Dunkley.
Thank you, Deputy Speaker. I rise to speak on this bill today because there is nothing more important than access to healthcare. There's nothing more important than equal access to healthcare, and that is the theme of this bill. But more importantly, it's not a theme for Labor, it's a heartfelt belief and commitment. I join in what my colleagues have said in respect to the specific provisions of this bill, but I want to take in particular this opportunity to raise the issues that have been presented to me by doctors, GPs, surgeries in my electorate of Dunkley. Because notwithstanding the view of the government that my electorate of Dunkley is adequately served by GPs, that's not how my community feels, and it's certainly not how a number of the GP practices feel, who have contacted me because they cannot recruit enough doctors to fill the need. They cannot adequately service some of the most vulnerable people in my community in Frankston and Carrum Downs because they cannot adequately recruit the GPs that they need. And they have made representations to me that that is because the way the system has been designed and is being operated by this government isn't working for them. I have written to the Minister for Health in regards to Total Care Medical Centre in Frankston, and one of the legendary doctors in Frankston who has given his life to being a GP and serving people. And with respect to two GP practices in Carrum Downs, one of the more disadvantaged pockets of my electorate, serving people who are vulnerable a lot of the time, but particularly now when we're in the middle of this global health crisis and pandemic. The Bellato and St Mary Medical Centres in Carrum Downs have contacted me and asked for help, and I wrote to the Minister on their behalf. I told the Minister that they are having difficulty recruiting Australian-trained doctors, particularly to the St Mary Clinic. They've tried many times as a participant in the AGPT program, but are on a waiting list and are unsuccessful. Ms Hatsopoulos, who's the practice manager for these two clinics, as I said, serving quite a vulnerable community, has informed me that because the region is not classified as a distribution priority area, the clinics have a restricted ability to sponsor doctors through visa programs. She's advertised a position online with SEEK. All 6 applications that came in required visa sponsorship, all of them, so they couldn't fill any positions from this ad. They attempted to participate as an after-hours medical deputising service, but due to program restrictions, it wasn't feasible to proceed with the service. Changes to Medicare benefits schedule will mean that the clinic will be financially disadvantaged because of a classification change, I'm advised, by those clinics. Their capacity to bulk bill has been changed. It will further impact on the clinic's ability to entice doctors and also to retain doctors. What these clinics, Bellato and St Mary's, have asked me to advocate for, and what the Total Care Medical Centre have asked me to advocate for, is a reclassifying of the Frankston and Carrum Downs region as a distribution priority area. The Minister has responded to my correspondence and has set out the reasons why the Department and the Minister are unable to do so, but in doing so also made the observation that they're content that Carrum Downs is adequately serviced by GPs. Well, my community's not content that they're being adequately serviced, and the GP centres aren't content that they can recruit the doctors they need to adequately service them. So I'm raising these matters in the parliament today as another opportunity for the government to look at these vulnerable areas particularly in this time of a global health crisis, and see what you can do to assist my community. I also want to take this opportunity, while we're talking about health and access to health, particularly in a time of global pandemic, to raise an issue that everyone, I think, knows by now is dear to my heart. I've said it before, Ladies, check your breasts. Men, listen to what your body is telling you and go and see a doctor when you need to. That is even more important now. I've been speaking to the Breast Cancer Network of Australia, amongst other service and support providers, who are very concerned that at the moment too many people are putting off going to see their general practitioner for other illnesses and ailments, for other checkups, because of their concerns about COVID-19. Don't do it. Go and get the checkups that you need. The Breast Cancer Network of Australia is there to support any woman who has a diagnosis or believes that they need to get checked, to help you to go through the system, to get the help that you need, and then if the worst thing happens and you get a diagnosis of cancer, to then help you go through your treatment. But it's a pretty simple message that we want to put forward to people today. Do not stop looking after the other aspects of your health just because we are fighting coronavirus. Go and get yourself checked by your GP if you believe there are any other issues that need to be addressed. And of course, the only way we can ensure that all of Australians can heed that advice, no matter what their income is, no matter where they live, no matter whether they were born here or came here, they're an Indigenous person in a remote community, they're a wealthy person in Toorak, is that we have a universal health system that benefits those who need it, a universal health system that works. It's more important now than ever, and it's more important that those of us in this place continue, as my colleagues on this side of the chamber will never stop doing, making sure that our Medicare, our precious Medicare system, is properly resourced and properly run.